I know sometimes people think, oh, social workers, they're the ones that go in and remove your kids. That's just one thing that some social workers do. But social workers are by the bedside when you're in hospice care and working with the family that's going to lose their loved ones. Social workers are in the schools talking to kids who maybe don't have anybody else that really listens to them.
This is Lightbulb Moments by USC, a podcast capturing moments of brilliance happening across campus. I'm Jessica Peretta from University Communications. In this episode, I talk with Ruth Szczepanovich, a leader in social work at USC. Ruth sheds light on what it means to be a social worker beyond the stereotypes, helping families and creating community programs, and translating all of this into the academic setting. She shares what the past has taught her and what the future holds for her field. Why do you think your work, social work, is important?
Where we live, who we are, who our families are, who our social interactions are, we know those are like the leading causes of so many of our social issues that we have in society. I mean, was it recently like isolation is a public health issue, right? That if people are isolated and they're not socially connected, and what we do in social work is connect with people and then help connect them with each other and help connect them with services and resources. Like, we're really connectors. That's a big part of our job. And I think that's so foundational to any of those other healthcare services and other services, and keep as a society, like helping us all kind of fit together. It's the work of making those social connections, right? And I think they're like the foundation of having a thriving life. So that's why I think social work is important. I know sometimes people think, oh, social workers, they're the ones that go in and remove your kids. That's just one thing that some social workers do. But social workers are by the bedside when you're in hospice care and working with the family that's going to lose their loved ones. Social workers are in the schools talking to kids who maybe don't have anybody else that really listens to them, then and can help them with the fact that they can't concentrate in class. Or social workers are in a hospital when someone is going to be discharged and they've got no home to go to because they're being discharged back onto the streets, and it's trying to find them somewhere safe for the night. And social workers are working with a family who's got a son who's seriously mentally ill and is going to be a danger to them or someone. And social workers are there helping support them to come up with a plan.
And I think that kind of goes with the question that I had next, was what confirmed that this is the work that you want to do and that you should continue?
The first thing that jumped to my mind when you said that was a conversation I had with one of our alumni, one of our students. She graduated and then she came to work at our trauma recovery center. And then she left, which is part of the goal, is that they will get their license and then they will go out into the community and use what they've learned in the community. And she met with me about the new job that she'd got. And she was just super excited about the job she had. She said she had learned so much. She'd had incredible supervision. She'd had a great experience. And she was sad to leave. But she had this great opportunity, and she was going to be working in the court system with people involved in the criminal justice system, but she was going to be able to use a lot of her skills. And that for me was exciting. Like, that's what makes me feel excited, is that she came through our program, learned to be a social worker. She even came through our clinic and learned so much about being a trauma counselor. And now she's taking that to the next level, out into the community where she's really going to make a difference with it. And so that feels like, although I'm not the one delivering the treatment anymore, I played a part in all those lives she's going to help touch.
Is there some sort of moment in your career you're most proud of?
A number of things come to, like as you go across your career, there's been those moments where, that was a thing that drove me to the next thing. When I was in San Diego, I remember and I was working in county government and getting all this data about our deaf foster kids that were in group homes all over the country, and knowing that they weren't seeing their family, and knowing that reunification is more likely if you see your family, and not knowing anything about deaf and hard of hearing, and having to learn it and reading lots of stuff, and then being able to bring a team together. And we were able to talk to the board of supervisors and get seed funding to open a group home in San Diego to serve deaf kids. At the same time, we started intervening earlier and placing kids with recruiting deaf foster homes and placing them there. And actually, at the end of 6 years, we didn't really need the group home anymore, which was a good outcome, right? You discover a need, and those are the times that that I get excited and that I'm proud of.
Have you ever had a time where you've had to completely change your thinking?
Right now, I'm serving as the interim chief administrative officer of our university clinical services. And that is an entity that was created about 4 years ago to provide kind of governance, and it's a peer review organization providing governance and structure to the allied health professions that are not part of KEC, that are providing clinical services out to the community, with a focus on risk, quality, and safety and compliance. And that involves social work, pharmacy, dentistry, OT, PT, psychology. But I suddenly learned so much more about what we were doing and why it was so important, what social workers can do to improve oral health outcomes, for example. I met with the people from OT and PT, and they're excited. They have clinics where their faculty actually provide the services. I'm like, maybe we could do that. Do you know what I mean? So I'm like, I hadn't even thought of our faculty doing it before. So now that's one of my goals, to see if we can do that. Psychology, it's right here in Dornsife, and yet I don't think we really knew what each other was doing. And now we consult on a regular basis about different things, and we're thinking about different grants that we could go to together. So in terms of something, I think getting involved with university clinical services, I now have all these new relationships across these different disciplines, trying to think about how can pharmacists and social workers work together. I mean, one of the things we know is a big challenge, particularly for people with mental health issues, is adherence to their medication. So how could social workers and pharmacists maybe work together to think about how we could improve medication adherence, for example, helping people that are seriously mentally ill have access to medications and stick to their medications so that they can have, more safer and more quality lives. I mean, so just like those kind of cross-discipline things, that has kind of changed my thinking about what's possible. And the way that we can do it here on this campus, right? And that we can kind of almost use those as laboratories for how things could happen.
Absolutely. And that's something that USC emphasizes, and, having that cross-discipline.
I think it's important. And I think, in a way, it's definitely, it is how social workers think about things, right? We think very holistically. Like, we know that when we've got a person maybe just sitting in our office who's maybe coming for help because they need some financial assistance, or they're in a domestic violence relationship, we're then looking at the whole context of where are they, right? And where do they live, and what's their community? And we do what's called a biopsychosocial assessment. How's their health, right? How's their emotional well-being? How are their friends? What support systems do they have? And we do a full assessment. That holistic part is what I think is so important about having all the disciplines work together. Otherwise, we're all working in our little silos. Do you know what I mean? And we're all doing our own little bit, and the client has to go from place to place and see each one of us, and we're not talking to each other. And then, so they get fragmented care, and we're not thinking of it as a whole. The whole is greater than the sum of its parts, right? Or we're all looking at the different part of the elephant, whatever analogy you want to use. Like, if we can all look at it together, then we can give more comprehensive care to clients. And we know that, like, if you think about social determinants of health, I mean, that's like 80% of what makes a difference in health outcomes are the social determinants of health, which is like where you live, where you work, where you come from, those things. You've heard about place matters. Those are the critical things about health outcomes, and yet we tend to invest so much of our time and money in that 20%, which is important, but that's all the great medical care that we can provide to people. If we can put that perspective and marry that with that, then we can, as a system, look at it more holistically. And I think we'll have better outcomes, not just for those people who can afford it, but better outcomes for everyone in society, which is better for all of us.
And what do you think influenced or leads your philosophy on, seizing this opportunity, but also pivoting and integrating these multiple problems to try to solve?
Okay, so I think it's probably a combination of things, but I do think there's just like innate strengths or talents that we have, right? So I often tell this little story, but when I was a kid growing up in England, which is the accent, I was called a chatterbox, a fidget Bridgets, and a bossy boots. And these were all things that were undesirable, that as a woman, a young girl, I was supposed to contain, right? I think I've gotten to embrace as an adult that maybe those are kind of a little my superpowers, right? So I like talking. I'm enjoying talking to you right now. So I can be a chatterbox. I'm fidget Bridget, so I can go from thing to thing. I can pivot. I can get excited. I can be doing an email, then get a phone call and be right. Do you know what I mean? And I kind of thrive on that. And then I was called a bossy boots, and I don't mind. I like being in a leadership position. I don't mind taking responsibility. I hopefully don't do it the way I did as a kid, which was probably not as refined. But so some of that I think is just, that's part of who I am. That's kind of how I operate. I'm clearly, I've also have learned and, grew up in an environment where doing something that was a benefit to the larger community and to those less fortunate than myself is an important driving factor. And then the skill, part of it's being a social worker. That's what I was trained to do. So social workers are trained to engage with other people, to assess the environment and what the need is, to intervene quickly and effectively, and then evaluate, is what I'm doing helpful or not? And if it's not, let's pivot and change and do something that is. So there you go. Those are the things, some talent, some learning, and then some kind of skills that you've actually learned.
What is the biggest change that you look forward to in your field, looking toward the future?
Oh, the biggest change. Okay. I'm interested to see how AI is going to be integrated into our field. I'm kind of, because there's both sides to this. I think within 1 week, I read a study that showed that couples that went for couples counseling couldn't tell the difference between the AI responder and the human responder, and they actually thought the AI was human and gave better responses. And then a week later, I read a study that said that people that were getting support for mental health issues online were getting really bad information and how detrimental it was. And there was a study. So, there's good and bad in it. There's, we all know if you're documentation and writing things, like AI can do so much of that for us, which seems like that's great. That will free up our time to do other important things and be interacting with people. But then the flip side of that is it doesn't always get it right. And then we've got issues about privacy and we've got ethical concerns. So there's a lot in the AI space. I'm interested to see how it's currently being used, but more like to think about how we could potentially use it. I'm thinking both positively in terms of teaching and practice and advocacy and societal change. I think there's a lot of positive things, but also just being cautious and being concerned that it might separate us more and isolate us more. What's it going to mean if, now our social connections are a bot? What does that mean about isolation and depression? Maybe it's a good thing. Maybe it's a bad thing. I don't, So I'm intrigued with that and how that's going to interplay with mental health and our social environment.
Thank you so much. Well, I really appreciate you speaking with me today and, giving us an insight. So thank you.
You're welcome. Thank you. It was fun.
Thank you for listening to Lightbulb Moments by USC. You can find this podcast on Spotify, YouTube, and Amazon Music.